Good afternoon. I am Commissioner Bender, Escambia County District 4, and I appreciate you all coming out today. Of course, there's been a lot of questions about what's going on Pensacola Beach, and we're seeing a lot of our neighbors take actions. And so, in working with our partners out here, we do have some announcements we'd like to make. And so we'll have the hoteliers come up and some people representing them with their comments, and then I can answer some questions about what we're doing on the beach and in general. So our two other speakers this morning will be Vic Bindi with Premier Island Management Group, and then Jason Nicholson, VP, Innisfree Hotels. Thank you.
Good morning, everybody. I'm here representing the lion's share of our hotels, property management companies, our lodging partners here at Pensacola Beach. And I just want to tell you that what we are trying to do is preserve a very responsible way, a way forward that's going to protect both the physical and financial health of both our residents, our guests, all of the employees and families that are here out on Pensacola Beach. Speaking of residents, we know that we have over 24,000 residents who are dependent upon their earnings and their salaries on Pensacola Beach. So this piece of paradise that we're all sitting on right now is we're all keenly aware that we need to protect it and preserve it for everybody. Together, we are proactively taking precautions that exceed every state and local official's guidance. In our employee spaces, we are doing daily screenings with our staff. We're instructing them that if you feel sick, if you feel under the weather, we need you to leave, go home, take care of yourself, seek the proper medical treatment that you need. We are limiting our occupancy at our resorts to below 50%. We've already started doing that. We are doing this proactively ahead of today. On our pool decks, we've removed half of our chairs and our loungers. And what we've done is we've separated them by 10 feet between pool sets. Out on the beach, we've separated our umbrella sets and chairs by more than 10 feet. I mean, if you look behind us, we're 30 plus feet in between sets. And we're also asking our courtesy patrols at our resorts to patrol the beaches, to patrol the pool areas, to limit our guests and families to congregations that are below 10 people. And everybody's been very supportive and very compliant with that, because we all know we're in this together, and together we're going to be able to get through it. Like I said, we've already started to do this proactively. We've been doing it. We're going to continue to do it as I've talked about here for the next 2 weeks, but we're going to continue to reassess this and following with our county and our local state officials hand in hand, listening to their guidance. We're going to go ahead and make this work. Our spring break here is all about families. We're some of the lowest density beaches here across the nation, and we want to do everything that we can to preserve and protect that. Thank you.
Good afternoon, everyone. My name is Jason Nicholson, Vice President of Innisfree Hotels. I had the unfortunate responsibility of communicating this morning some potential impact to the jobs in tourism on Escambia County and along our markets in which we operate along the Florida and Alabama Gulf Coast. I'd like to start by applauding Commissioner Bender and the Board of County Commissioners of Escambia County for relying on data and science to drive their decisions, because ultimately those decisions, as we very well know, impact humans both in a health position but also in the financial way. What we're finding on Pensacola Beach is that our guests and teammates are doing a very good job of self-policing and keeping distance from one another, ensuring that anything that they happen to touch is sanitized. And at the hotel and restaurant level, we have the benefit of already working in an industry with very high sanitation standards, and we have increased those appreciably. We've enacted processes such as shutting down our self-serve buffets and moved to a plated option so that guests do not touch the serving utensils, the plates, or the food. We've also moved our housekeeping departments to a process of only cleaning the rooms and sanitizing the rooms at checkout. So in other words, there will be no more stayover service in our hotels. We'll only clean those and sanitize those at checkout. And in addition, we'll work with our partners along the Gulf Coast to make sure there's adequate spacing on the beach and maintain our occupancy levels at our hotels at no more than 50%. 50% keeps staff employed. If this morning the outlook looked like a 90% layoff, allowing hotels to operate at 50%, which is a very, very manageable occupancy level, allows half of those to keep their jobs. And with that, I'd again like to applaud Commissioner Bender for using data and science to drive these decisions and collaborate with the industry partners so that we can self-police and come out of this stronger. Thank you.
Thank you, Jason and Vic. So as we said, this is something we've been working on over the last day or so to protect our community. As we see these beaches around us that have much different spring break than we do, we always like the fact that we are more of a family spring break, and this is more of a family atmosphere on the beach. We don't typically see the issues like we saw in Miami and Clearwater with the large college spring breaks. And so with that, I appreciate the industry saying that, yes, we're keeping our beaches open, but we are not welcoming everybody that's been rejected somewhere else. So they are proactively taking the steps to protect our community while still allowing us to keep this beach open. Some of the things that, of course, as the communities around us are taking action, we are following that to see what they are actually doing. And I think that's important to see, to look into. So to the west in Alabama, they're closing their access. They don't necessarily own the beach like Escambia County does. So the beaches behind condos and houses are still remaining open and hotels, but the small sliver of public beach is what's actually getting closed. And so we have the ability to keep all of our 26 miles of beach open. I've talked to Superintendent Brown with the Gulf Islands National Seashore. They are currently open, and so to have people come out and enjoy the 80% of Pensacola Beach that is not developed is what we're allowing to do with this, while maintaining the CDC recommendations and ensuring the health of not just the guests but our community. We are of course open for business. But we don't need everybody to come down and have this look like we typically do in the middle of summer. So with that, I would take any questions, of course.
Why not just close off sections of public beaches like some other communities near us are doing right now? I know you chose to do it here at Margaritaville. You look out there, it doesn't look very busy at all, but just look to the right of you. It doesn't look like too many people are following the group of 10 rule out there. Maybe you disagree.
So the question was why we're not closing the beach entirely. And actually, I was just down there, and it did look like they were following the groups of 10. Our public safety actually put an announcement over the PA advising them that they needed to stay 6 feet apart, that they not in groups of 10, and to constantly wash their hands and the other guidelines that we're following. The difference here is that Escambia County owns all 26 miles plus, or in conjunction with the Gulf Islands National Seashore. So we have the entire beach. It wouldn't just be the small sliver that's just in the area where the public can park. They can go down to Park East and Park West to get away. They can go down past Portofino and park on the shoulder and just walk out to a wide open beach. So that's why at this time we're not taking the steps of closing the beach.
But the steps you are taking, you're saying, have just been done in the last few days. What's taken so long? I checked out the beach last weekend. There was a lot of people here from all across the country. It was packed.
It was last weekend. The group of 10 didn't go in effect until the governor announced it on Tuesday. And we saw a positive response from our community in that even from Tuesday to Wednesday, we saw a positive response in that those groups were trying to limit to 10. And as I just said, we saw that our public safety was being proactive and making announcements to keep that and make them aware of that.
Do you have the power to do any of these things before the president recommends them?
Personally, I don't. It would have to be a Board of County Commissioner decision.
What data and science are you using to justify these?
Well, again, we're looking at the number of cases we have in Escambia County, that we are following the CDC guidelines, that we are able to socially distance and have that 6 feet of separation. As you can see, we have a deep beach and a very long beach of 26 miles. So it does give people the ability to come out here and follow the recommended guidelines of the CDC in relates to the virus.
Following up, the Okaloosa County Director of the Department of Health told that county commission meeting this morning that having the beaches open, drawing people in from larger cities like Birmingham and Atlanta, where the cases are higher, is going to lead to deaths here. Why, and urge that county to close down their beaches. Have you heard anything like that from the Department of Health?
I have not, and I did reach out to Dr. Lanza this morning. I think you have to look at the difference between the counties. That's why the governor has also given it, left some of the decisions up to the local government to decide. We have a good tourism industry here. I'd say it's really great, but it's still 25% less than what Okaloosa has. We have a lot of residents that live on the beach. And so we are different than Okaloosa. And I think that's why the hotel's being proactive and not telling Atlanta and Birmingham that they're open for business is a great step in the right direction. They may be closing their beaches, but that doesn't mean that their people still aren't coming to hotels and condos. And so that's what we're doing. We're saying we're leaving our park open, but we're limiting the number of people that can come.
What is more important to you at this point, saving lives or protecting the dollars of the economy here?
I don't think it's, asking what was more important about saving lives or protecting the dollars. I don't think it's about protecting the dollars. It is about saving lives, and that's why they're taking these measures on their own, that are taking these next steps to say, again, the beach, I've talked to health professionals that have said the beach is a great place to go. You're out in the open. As it warms up, you can maintain the social distance. You're not confined in a room or a house. And we have the space to allow people to go out there with as much undeveloped areas along the beach that we have.
Anything being done to help the homeless population?
I have not talked about that with our board yet, but I know we have community partners that are always looking out for and taking care of the homeless population.
With people coming in and out of town, are the hotels here taking any screening precautions against?
They are, and Vic, do you want to talk about that?
Yeah, we're addressing that with each of the guests. So we're handing out flyers. We're talking about the COVID-19 symptoms with our guests. We're being proactive with them so that they can become educated, so that they can, much like all of us, protect ourselves and our families. The more that they know, the better it is. And like Commissioner Bender had said, I mean, keeping the beaches open gets them out of the rooms. It gets them out onto this wide open space. He said this is 26 miles of beach out here. This is perhaps one of the safest places you can be. So they're going to come, they're going to travel. We need to make sure that it's all done very responsibly.
So you're just handing out
Educational flyers, and we are engaging with them, going through the flyer, saying, hey, if you exhibit these symptoms, you need to take the proper steps. You know, and we have great partners in Ascension Baptist and West Florida Healthcare, and they're helping us guide us through this thing. This is truly unprecedented. So we are working hand in hand with our state and local officials and all of the medical facilities available to us. And I mean, we have an amazing, amazing healthcare network here in Pensacola, unlike any other community our size. So they're helping us navigate through this as well.
I have a question for Robert Bender. We know you've been doing deep cleanings in county buildings. Is there any sort of deep cleaning, sanitation work going on for the public facilities here at the beach?
Well, we're constantly cleaning those facilities daily. not specifically aware of additional measures, but I'm sure that we are taking those as we are with all of our buildings in the county, from libraries to our county offices downtown.
Commissioner,
Yes, ma'am.
what would the threshold be to close this beach? What data would create that situation?
I don't think it's necessarily been established. Of course, we have to look, asking what data would be established to close the beach. I think we have to look at data as it comes in. If if more cases start to develop in Escambia County, and I think we are anticipating a meeting tomorrow for the Board of County Commissioners, which could be discussed at that point. But we are looking at what we have now, what we have to offer to our citizens to come out and separate, get away, get outside. And so right now we don't have a hard, fast rule, but we will continue to evaluate it. So all of these measures are at this time. If circumstances changes that warrant us to do that, then that option is still on the table.
I would just heard the last gentleman say that this is one of the safest places you could be. Do you agree with that? And if that's true, why isn't the federal government or you or anybody else ask everybody else to get out of their houses and come to the beach?
Again, I don't think that asking why the federal government has everybody come to the beach. Well, again, we don't want to drive everybody out here. I think, again, that's what the hoteliers are doing by limiting the capacity of 50%, in that if everybody did want to come down here, we wouldn't accept them because that could be where we do lead to issues locally. By cutting it to 50%, allowing them to spread out, just like the restaurants are doing with going to 50% capacity in the restaurants, allowing that social distancing, allowing it in the beach chairs. They are taking the steps to follow the CDC guidelines.
Going back on the testing, you said you're waiting for more testing. Right now, the Florida Department of Health has only registered 17 tests being done in Escambia County. I mean, how confident are you that virus isn't here right now, like not spreading on the beaches right now?
As the drive-through testing, how confident am I that it's not here, and the fact that the DOH has only recognized that we've done 17 testing cases. Of course, those are only the ones that the DOH have completed. We've seen numbers from Extension Healthcare. I think they had 60 the first day, and maybe 90 the second day. And so we're now in that 3 to 5 day window that they were anticipating test results back. So they should start to get those back. As we've also noticed, it's important that we don't announce anything about presumptive positive cases until we hear about it from the Department of Health, that they've verified it, because we don't want to say that there was a case somewhere and then not have that pan out. So that's why when the first case was announced, that came from the Department of Health, because we had not received confirmation from them that there was a case in Escambia County. So that's why it does go through the Department of Health.
Anything big enough for your poll workers that are having to deal with money and various people?
We are making sure that everyone has the hand sanitizers and things like that come in. So asking about toll workers and what's being done for them. And it could be something that we discuss again tomorrow if we have the meeting. So any other questions? Well, lastly, I would like to thank Vic and Jason for speaking, and of course the Hotels on the Beach for being proactive in helping our community and still allowing the population, the public of Escambia County, to come out and enjoy the county's greatest asset. Thank you so much.